I can't even figure out what I want to say about that. Hi, I'm Dr. Alfred Hicks. I'm a spine surgeon at the Hartford Connecticut Orthopaedic Institute. I'm here to answer some commonly found questions that we have seen on the internet and on social media. What causes back pain? There are a lot of causes of back pain. Sometimes back pain comes from an injury. In the spring, I see a lot of injuries from people that are starting up in the garden, or it could be old chronic injuries, or even just family history and genetics. Why does my back hurt when I sit or stand? Sometimes when you change positions, there are structures in the back that are irritated, and changing the positions can irritate those structures and cause back pain that sometimes gets better and sometimes does not. What does sciatic pain feel like? This is a very common thing that I see in my clinic. It usually is a patient that comes in with back pain and pain that will radiate down their leg. They'll feel a shooting pain, sometimes a numbness and a tingling, as well as weakness on occasion. Can a herniated disc heal on its own? Oftentimes, herniated discs will heal on their own. I have lots of patients that ultimately get diagnosed with a herniated disc through an MRI. When we start treatment, I am often surprised at how much and how quickly patients do get better, but I would recommend that you engage in some treatment if you're experiencing symptoms from a herniated disc. Is working out safe with back pain? I think it depends on the nature of the back pain and how severe it is. Obviously, when we are younger, we do exercises and work out and we feel pain in our back or just general soreness from working out. And if it is a minor amount of discomfort, that's very safe. But if you're a person that works out, has a lot of back pain and pain that goes down your leg, I'd recommend you have an evaluation before you continue to do perhaps some of the activities that caused this in the first place. When should I see a doctor for my back pain? That's a great question. I do have patients who twisted their back that morning and they come in and see me as the spine surgeon, and I have patients that waited 5 years. And so there is probably some point in the middle that is most appropriate. If you hurt your back, giving yourself a few days of rest, maybe some anti-inflammatory medications or Tylenol, is generally what will help your back pain. But if your back pain persists for more than a week or two, and it's not getting any better and it's really interfering with your ability to do things, seeking out help from either your primary care doctor or from a back doctor is a good move. There are many treatments very short of any kind of surgery that generally help most people. What are alternatives to back surgery? Back surgery should not be the first thing that is discussed if you see a doctor talking about back surgery or even fairly new onset leg symptoms. Rather, I would recommend conservative things with medications, physical therapy. Some people do chiropractic sessions, massage, even epidural injections. Those are all effective treatments for most people. Now, there are people who don't get better. They continue to have back pain and leg pain. And for those people, surgery might be a good option for them. And with modern techniques, people, I think, have a very good outcome if they have the right surgery at the right time for the right problem.